Hi, my name is Kaylee Sullivan. I am currently an instructor of clinical nursing for the University of Rochester and their advanced program for non-nurses. Today, I'm going to discuss with you the responsibility of nurse leaders regarding compassion fatigue. As part of this background for this topic, I had to find an understanding of what exactly compassion fatigue is. Many of us know what it is, and many of us have had to work through it ourselves. For those who may not know the complete definition, compassion fatigue is described by Romano as when the amount of empathy a nurse is giving is greater than what they are able to restore. In other words, we're pouring out our cup into another's without refilling our own. When researching compassion fatigue, we can also see a couple other terms pop up. These include burnout and secondary trauma. Burnout is described as a syndrome that happens when nurses are continually put through stressors at work. This may look like short staffing, increased patient acuity, or even increased patient census. Secondary trauma, on the other hand, is defined as a stress or trauma that one goes through while caring for a person who has experienced or is currently experiencing trauma. Those are the tough cases, whether you're taking care of someone who has gone through sexual harassment or child abuse, or even taking care of someone who's recently lost a loved one. The purpose of this literary analysis was to discover ways for nurse leaders to assist their staff when they're feeling the effects of compassion fatigue. First, it was important to explore the signs, symptoms, treatment, and prevention of compassion fatigue. As nurses, when discussing an infection or a disease, we start with the signs and symptoms and we go from there. Approaching this topic in the same manner is key in not only understanding compassion fatigue, but also being able to help others comprehend it also. When it comes to prevention and treatment, this is where the role of nurse leaders come into play. Nurse leaders can spread awareness and information on compassion fatigue, burnout, and secondary trauma. From there, providing staff with opportunities for self-care and also creating a healthy work environment allows for those suffering from compassion fatigue to receive help, but it also aids in its prevention. These findings suggest that when nurse leaders take responsibility in the care of their staff, they not only impact those they lead, but also the organization as a whole and the patients for which they're taking care of. This research showed that nurses who suffered from compassion fatigue, burnout, and or secondary trauma were no longer providing quality care to their patients. They were recognizing that their cup was empty and they can no longer give to others. And when this happens, they no longer feel that they're capable as nurses. Not only does the organization then suffer due to poor patient care, but those with compassion fatigue often leave their jobs. When we're able to address compassion fatigue as a real problem and understand its wide impact, we're able to better take care of our nurses and our patients, both now and in the future. My hopes in this presentation is not to just sit here and explain to you what compassion fatigue is and how we can help prevent and treat it, but also to understand that we're now bringing forth a new generation of nurses that have been through the COVID pandemic. We're bringing through nurses that have gone to school during this COVID pandemic and being able to teach them the signs and symptoms of compassion fatigue helps prevent it. And it also helps teach our current nurses how to be a role model for those that they are teaching, and they can also spread awareness of this in the hopes that our nurses can start taking care of themselves. Because no matter what, if we're not taking care of ourselves, we can't take care of our patients. And that's what a nurse truly is someone that can take care of another person. Thank you.